Hello, everyone. I wanted to send a very warm welcome to all of you. This is Dominica with Surround Health. It is a gorgeous day here in New Jersey. I hope it's just as beautiful wherever all of you are today. Thank you very much for joining us here today. So as we get started, just a couple of housekeeping rules. If there are any questions at all for any of the panelists during the webinar, please type them into the questions section in your control panel. We will be getting to the questions at the end of the webinar. We are also tweeting during this webinar, so if you are on Twitter, we hope you will join us at the hashtag #SHWebinar. We are recording the webinar and archiving it on Surround Health, so if for some reason you missed any portion of this webinar, don't worry about it. You will be able to listen to it again. We have also been pre-approved for 1 CHES and 1 RG credit. So just please be sure to complete the feedback survey at the end. It will pop up once you leave the webinar. And we will have your certificates available starting tomorrow. And you will receive an email that will let you know that. Okay, great. So just to give you a little bit of background about today's webinar. So the idea for this webinar actually came from our Surround Health members. So thanks to all of you. Basically, over the last year or so, we've been hearing quite a bit from different health professionals from many different backgrounds who have been very interested in learning more about the different and unique career opportunities that are out there, and also for ways for them to move beyond the traditional healthcare careers. So for today's webinar, we've asked 4 terrific panelists to join us today. All of them have had very unique career paths themselves, and we'll be talking about different paths that you as a healthcare professional might either not have known about or wouldn't have considered before. Some of these careers could be full-time. They could be a side business or something that starts off as a part-time gig and then grows into a full-time career. As I mentioned before, we will be hosting a Q&A session with the panelists at the end, and we hope that all of you participate and take advantage of their expertise. The 4 guest panelists today include Tricia Torrey, founder and director of the Alliance of Professional Health Advocates, Melinda Huffman, co-founder of the National Society of Health Coaches, Joanne Peterloo, associate director of Healthcare Executive MBA Program at University of California, Irvine, and Sid Slubber, president and co-founder of LearnItLive. So now I would just like to take a minute to introduce our first presenter, Tricia. Tricia is every patient's advocate, a name she gave herself after a heinous misdiagnosis in 2004, which prompted her to change careers to patient empowerment and advocacy. Today, she is About.com's Patient Empowerment Guide. In 2009, she founded the Alliance of Professional Health Advocates, an organization that provides business support to help private health advocates start and grow their practices. She has also written 3 books, including 2 business books for anyone who hopes to start and build a private health advocacy practice. Tricia has appeared on or been quoted by CNN, NPR, USA Today, O Magazine, Health Magazine, Fox News, MSNBC, and other media. I now would like to turn it over to Tricia.
Thanks, Dominica. Can you hear me?
Yes, we can.
Okay, great. I'm so pleased and appreciative to be invited to speak with all of you today. I think you're like the perfect audience for me, so this is a real treat for me to get to speak with all of you. I understand that you are folks who are interested in entrepreneurial type careers, or perhaps moving on to a different kind of career than you're in now. And so I'm here to make the case for something that's actually a fairly new career of private patient advocacy. It's actually a career that's growing as a choice, especially for those who are making maybe mid-career changes or people who are looking for some sort of an encore career, perhaps transitioning to retirement or wishing to be independent in some way and hoping to find a great way to help others while not tying themselves down sometimes to the demand of an employer. And I know that one of our speakers later is going to be talking to you about employment. So this is really a different point of view. You don't have to have a clinical background or necessarily clinical expertise, although you do have to have a great deal of knowledge about the healthcare system. So whether or not you've spent a career as a nurse or a physician or in some other clinical profession, or if you've had your own experiences navigating the healthcare system for yourself or perhaps for a family member, or maybe helping to figure out payment systems, because that's a very fast rising aspect of private advocacy, you could have a career as a private professional advocate. So now, Dominica, I'm going to ask you, if I click on this thing, does it advance the slide, or are you doing that? Nope, it just did. Excellent. Excellent. So we'll start out with what is health or patient advocacy, and you've probably heard a lot of these terms, and actually they're very confusing. We are new enough that we get mixed up with all kinds of other people too. I like to use a broad, excuse me, a broad definition that basically says that a patient advocate or navigator can help patients get what they need from the system when the system doesn't currently provide it. And what we're finding, and these are things I'm sure all of you have heard in the positions you're in now, is that there are some big holes, big gaps in the healthcare system right now that have to do with care coordination. You may not be able to get your doctors to talk to each other, for instance, to medical billing problems. They say that 80% of all hospital bills have errors in them. They could be problems in the hospital. Just staying safe, making sure that someone doesn't acquire an infection or have a surgical error of some sort. So those are all holes and gaps in the healthcare system that patient advocates are poised to provide fixes for. And you've probably heard a lot of other names. Nurse navigators, family mediators are working more and more in the aspect of helping with healthcare decisions. Health coaches, and I know that Melinda's going to be talking more about health coaches in a few minutes. Medical bill reviewers. Again, these are all different aspects of advocates and navigators. I've posed the question here, is there a difference between advocates and navigators? Well, basically, yes and no. The term navigators is actually being used in a lot of different capacities now. It may mean someone private, like I'm talking about today, or Obamacare is now going to be hiring navigators to help people select the right health insurance for them beginning in 2014, and so that term is being sort of co-opted to Obamacare. Also, you might find navigators in hospitals helping cancer patients in particular, and they are employed by the hospitals usually, but even the Joint Commission now is beginning to look at the use of navigators in hospitals as a positive for hospitals. But again, those folks are different from the folks I'm talking about, because what I'm talking about here really is this new career of private, professional, independent advocacy. So one of the ways we define the difference between those who are employed and those who are working independently is something I call the allegiance factor. And the allegiance factor is simply looking at the payment model and then looking at whose allegiance is primarily, number one, right at the top, to the patient. So, for instance, if you hear about an advocate who's working for an insurance company, they might be doing a really good job, but at the end of the day, they're getting their paycheck from the insurance company. And so their true allegiance has to be, number one, to that insurance company. The same is true with an advocate who's in a hospital. And there are patient advocates in hospitals who do wonderful jobs, but they do them to an extent with one arm tied behind their back, because they're still working for the hospital, and in most hospitals they're working in the risk management department. So if you're talking about a private independent advocate who is working perhaps directly for a patient who's directly writing a check, or might even be working for an employer or a church or a union whose real allegiance is only to that one patient, that's the kind of thing we're talking about with the allegiance factor, and that's the kind of thing we're talking about with private advocates. So who's choosing this career and who's good at it? Well, I gave you a little bit of an overview of the folks who are choosing it. They mostly seem to be people who are making switches in mid-career, and that's because to this point there have not been like a degree. You couldn't necessarily get a degree in health advocacy or certificates, but I'm going to tell you more in a moment about some of those programs that have popped up just in the last few years. But those who are choosing it have some points about their personalities and so forth and their skill sets, and I will come back to those. But they're mostly people who are people sorry to be redundant, who look at the great ways and the alternative ways to get their clients through the healthcare system. We are pioneers. This is brand new. Even though there have been individuals who've been doing private patient advocacy work actually for a decade, maybe the last 15 or 20 years, they've been few and far between, and I would say you could probably even count them on two hands. In terms of a larger group, Now, at this point, we have about 150 to 200 successful private advocates. Those are people who are running individual practices in the U.S. and Canada. And we have 300 or 400 more who I say are in the pipeline. They're folks who have self-identified as being interested in being private advocates, and they are members of the alliance that I founded, the Alliance of Professional Health Advocates, which I will give you more information about. There are people who've said, you know what, this looks interesting to me, and I want to learn more, and I need to learn about running an advocacy business. And so what we hope is that we can convert many of them from the just thinking about it point to the point where they are also individual advocates. So how can you get started if you have interest in this? Well, you're going to start with a personality and skill set. Remember that being a private advocate means that you are self-employed. It means that you have to have all those attributes of a good self-employed person. You need to be self-disciplined, you need to be organized, you have to be okay with not getting a steady paycheck and knowing that you will get paid when the time comes, but it won't be every Friday or every other Friday. You need to be able to think outside, for lack of a better description, the traditional healthcare system box. So if you've worked typically in the bureaucracy of healthcare or even in the government, maybe as a social worker, you need to be able to step outside of that sometimes and look back in. I call it the chutzpah of not necessarily going with the flow or with the recommendations that the professionals have made, because sometimes those recommendations are in the best interest of the professional or the hospital or facility, not necessarily in the best interest of the patient. You also have to be willing to market your services and market your services and market your services, because this work doesn't just doesn't come to you. People don't necessarily just pick up the phone, because in many cases they don't even know private advocates exist. The only other thing I would say to you about thinking outside this traditional healthcare system box is that the most successful private advocates have been those people who really have been willing to go up against the system that has always existed, because that system just keeps going downhill in so many ways. And I look forward to one of our other speakers who's going to talk about how some of that's being changed within the educational system. As far as credentials are concerned, right now, as I mentioned, you really don't have to have a background in healthcare at all. You just need to understand the healthcare system. Further, there is no degree that addresses this. There are about 24 programs, and I'm going to give you a link at the end so that you can find out about the programs that exist. They're offering certification to that program. There is no national credential. We do have a group that's working on it. So there's not a national certification. There is no licensure for this position yet. It's going to be another, I think, 3, 4, 5 years before we have such a thing. So folks that are jumping in now will probably be grandfathered into those kinds of programs. But the other part of this is the education that you're going to need. You need advocacy skills and a knowledge of the system, but you also need to know how to run and grow a business. And in some cases, that's more important. There are some very successful advocates out there who are just really good business owners and know how to get the word out and then gain the experience. Whereas there are an awful lot of excellent advocates out there who don't do the marketing, they're afraid to do public speaking, they don't market themselves well, and they are floundering as far as their businesses are concerned. So make sure that any education you seek or any skills you seek have both of those components, the advocacy skills and the business skills. I want to run through these challenges real quick. These are some of the problems that we're running into as we grow this profession. One is that the general public is just beginning to learn about the existence of patient advocates. Now, that's truer in some areas than others. We do have some areas, Boston, the Bay Area of California, Southern California, Phoenix area, parts of Florida, where private patient advocates are becoming fairly well known. They're being called care coordinators, care managers, lots of different names, but people understand that that exists, and so they know to go looking for them. In any other area of the U.S. and most areas of Canada, if you want to be doing private advocacy, you need to understand that you're going to be educating your market first, educating people to the fact that you exist, even before you educate them that you're the person they should hire. I mentioned earlier about the confusion in the marketplace over the term navigators. I don't want to dwell on that anymore. If anybody has any questions, I'm glad to flesh it out a little bit more later. Figuring out what to charge. Oh, that didn't show up. So, oh dear, we've got a problem with these last bullets, Dominica, but I'll just go on. Figuring out what to charge is another one of the challenges. Figuring out what your hourly rate is. Now, I've heard a range everywhere from $75 an hour on up to $450 an hour is the most I've heard about. I will tell you that the people who are charging $75 an hour probably are not charging enough, and the people that are charging $450 an hour are very, very much into a niche of the work they're working on, and they can command that kind of money and they stay busy. What about insurance reimbursement? There is no reimbursement for private advocates so far, and I would also argue that we don't ever want to get in a position to where we're looking for reimbursements, because the minute you're reimbursed by somebody else is the minute somebody else can tell you what your answers have to be, and that goes against the whole grain of what a private advocate is supposed to do in thinking outside of the box. A couple of objections that we hear from people in the marketplace who think they might want to hire an advocate but aren't really sure. They get into a conversation and they say, yes, but this is private pay. I can't afford that. I think only the rich people can afford private advocacy. But that just is not true. You can hire someone sometimes for just a couple $100, and they might save you tens of thousands of dollars on a hospital bill. Or maybe you hire them for $1,000 or $2,000, and you find out that that $50,000 surgery that somebody told you you needed to have isn't really the right answer for you anyway. The other objection is what I call the waiter will spit in my soup. There are patients who are afraid to hire a patient advocate because they're afraid that the doctor won't like it. And we found too, anecdotally, we don't have research on this, but we have found that when doctors understand what an advocate can do for them, that it's win-win-win for everyone. And this waiter spits in my soup thing just does not apply. And then my last point really is just about the Affordable Care Act, Obamacare, and our profession as private advocates, how it relates to Obamacare, and that is that I call it job security. Over the next 12 or 15 years, the healthcare system in the United States in particular is going to get more and more confusing, and then it will start to make some sense, and then we will find that it levels out and people are getting what they need. But for right now, especially on the backs of baby boomers, the more confusing it gets, the more people will be turning to someone to help them get through the system and get exactly what it is they need. So let's see if we can go through to this last slide, which it's not doing. Okay, Dominica, I'm going to ask you to take over. There we go. Let's get started. I would invite you to take a look at private advocacy as a profession. If you go to this web address, healthadvocateresources.com, you'll see a whole slew of resources that you can take advantage of. And I invite you just to poke around. Some of them are free. 2 of them are books, and yes, you can purchase those books either at Amazon or in other places on the book's own websites. The organization I run is the Alliance of Professional Health Advocates. You can spend $49 and spend a year figuring out whether or not that's what you want to do, and then find all the resources for doing it if you decide that you do want to become a private advocate. And I'll look forward to any questions you've written down at the end of the program.
Great, thank you so much, Tricia. And I apologize, I have no idea what happened to those slides.
I don't know either.
Them.
No problem.
That's okay. Well, thank you very much, Tricia. And again, if anybody has any questions for Tricia, please type them into the questions panel on in your screen, and we'll certainly get to them at the end. There was also a question about downloading the presentation. We will be emailing it out to you along with the archive. Great. So now I just want to take a minute to introduce our next speaker. Her name is Melinda Huffman. Melinda is the co-founder of the National Society of Health Coaches and is the principal of Miller & Huffman Outcome Architects. She's a best-selling author, writer, and speaker and consultant. She was a former director of disease management for Amedisys Incorporated, director of nursing education, Mutlow College, and patient care administrator for Southern Tennessee Medical Center. Melinda has her BSN from University of Alabama, Birmingham, and an MSN from the Catholic University of America in Washington, D.C. She's authored several books and articles on evidence-based health coaching, evidence-based clinical practice, and outcomes management. And now I'd like to turn it over to Melinda.
Thank you, Dominica, and good afternoon, everyone. It's my pleasure to be with you. Well, evidence-based health coaching is definitely in. It is the newest emerging role in healthcare to gain and to garner as much emphasis and interest as it has in just the last 3 years. So just what is a health coach? Well, we consider a health coach a trained professional who uses clinical interventions, including skillful conversation, and that's the key, that actively and safely engages patients by tapping into their own motivation to change unhealthy behavior. And there's several other things that come as a result of that. The improvement in self-management of health conditions, reducing health risk, thereby improving outcomes with the ultimate goal of improving quality and reducing overall healthcare costs. So what are the typical credentials of this person? Well, that depends on the type of program that you seek for training. The National Society of Health Coaches offers a more clinically based health coaching training and education program. Our focus is on providing health coach certification to those who have clinical credentials. Let's say that of a registered nurse, a licensed practical nurse, a physician, a pharmacist, registered dietitian, therapist, physical therapy, occupational, and so forth, as well as specially certified health educators with experience in a clinical setting. Some programs train all individuals. So they take individuals from all types of backgrounds. Their programs are much more lengthier, and we'll talk about that a little bit more in just a moment. So what type of work and work setting do we find health coaches in? Today we're finding them in all areas of healthcare, and especially now that we're beginning to move into wellness and prevention more than in any decades of the past. Independent practice, they're practicing in hospitals, within accountable care organizations, medical homes, managed care, insurance companies, community-based health clinics, home care, employee health, occupational health, skilled care facilities, even hospice and end of life. So we're finding health coaches in just about every healthcare setting with the exception of nursing homes, at least at this point. So how do people get started in this type of career? Well, today you'll receive a different answer depending on who you ask. I say this because currently there's many differences of opinion in what these requirements should be. The National Society of Health Coaches recommend that you select a healthcare career that requires licensure or a credential that is regulated by your state, or a special certification that is also regulated in the clinical arena. And you'll know absolutely that going forward, you're going to meet the standards for health coaching in the future, as we believe that this is going to become an issue of public safety that's raised about those who are qualified to provide health coaching services. And these types of careers include those that I mentioned just a bit ago. So what are the top 5 characteristics of a health coach? And we've asked that question and surveyed many, many health coaches, and these are these top characteristics that they believe and that we believe are the best. An excellent listener. Now, we may all feel like that we listen very, very well, but in health coaching, those skills are honed and are intensified to a degree that we're listening for certain things from that patient or the client that we're working with. Collaborative partner. You'll hear a lot about partnering in the years to come in terms of health coaching and healthcare in general. Be non-judgmental and very empathetic. It's interesting to note that most healthcare providers today believe that we exude a lot of empathy, but the research shows us that in many cases, many times, that patients do not feel the kind of empathy from us that we believe that we extend. We have to be knowledgeable and also insightful and very empowering to those patients. There are skills that we learn that will help empower those individuals that you're working with. So the difference in health advocates and health coaches are basically that a health advocate assists laypersons to really kind of navigate through that very complicated, as it will be in most cases, healthcare system, whereas health coaches are guiding patients and clients in behavior change. We're tapping into their own motivation to change unhealthy behavior, thereby improving their own outcomes and self-management. So what will be the impact on health coaching from the Affordable Care Act? And that's an excellent question. The future is going to be and is prevention and wellness, and the medical community is really moving steadfastly from the past focus on emergent care and sickness to that of wellness and prevention. The Affordable Care Act actually brings this into focus very clearly due to several things: less money being paid for those long inpatient hospital stays and readmissions, and more emphasis being placed on paying for preventive care. For example, most insurance companies will pay 100% for screenings like vaccinations or mammograms and the like. But the goal of health coaching is perfectly aligned with the Affordable Care Act, and that's to guide people to adopt those health behaviors or to change unhealthy ones that will reduce risk, lower the cost, and improve outcomes overall. So what is the anticipated growth or decline in health coaching from the Affordable Care Act? Health coaching is now really in its 4th year of just exploding growth. And until our country honestly gets medical costs under control and then continues to provide services at a manageable cost level, we believe that health coaching will only continue to grow nationwide as it has in recent times. The fact that you can provide health coaching services telephonically and also through video like, well, say Skype or Apple's FaceTime means that health coaching can be delivered very efficiently and economically. And this is in perfect step with the goals of the Affordable Care Act. So why do health coaching programs differ so greatly? Well, we believe there's 2 primary reasons for the variance in these programs. Currently, there are no definitive nationwide standards. Number 2, some programs are not evidence-based, meaning they're not based on science. And the developers of these types of non-evidence-based programs define health coaching differently. They're using the buzzword, if you will, of health coaching to sell people on the premise that anyone and everyone should be and can be an independent health care coach. But then we also have wellness coaching and personal coaching, and there's so many different types that we believe the difference in health coaching is truly that healthcare provider who works in the clinical setting and has the expertise of a clinician or a specially trained educator to be able to meet those needs, whereas a wellness coach would be more in line with those who considered healthy, more of the type of individual who is employed and are trying to keep those health risks at bay. So which type of program is right for me? At the Society, we literally receive hundreds of calls asking this question, and it's an excellent question. The Society wants to help people to choose the right program that's best for them. They're trying to determine what career path is best, and we want to help them achieve that. As we've said, not all are evidence-based, but ask the question, what scientific evidence is your program based upon? The evidence is important because it will help you replicate those results and outcomes for those patients that you deal with over and over. You need a replicable program as well as a reputable one. Health coaching skills can be learned and used by non-licensed people, and these people fill very important roles within the healthcare team. In that case, of course, our program can also be used by the non-licensed individual. The employer at that point, in that case, would hold the responsibility for the services that are rendered to their consumers and patients on the behalf of the employee that they have hired. So why is health coaching a good career option? Well, a good career option, in our opinion, is one that really stands the test of time. And the health coaching purpose being to guide people to adopt healthy behaviors, we do believe will reduce the overall risk of healthcare risk and the overall cost of health care. The need is only going to continue in our country for decades to come. We have clinicians that tell us all the time after implementing evidence-based health coaching, wow, after all these years in practice, I finally feel like I'm making a real difference in patients' lives, and I really like it. About the NSHC, the National Society of Health Coaches, our founders and our professional advisory board are composed of clinicians and practitioners in clinical settings or in university programs where clinical practice is part of the requirement for getting a degree or a license thereafter. We offer a guided self-study health coach certification for those who are licensed and some exceptions that are listed on our site and also a certificate of completion for allied healthcare providers and those unlicensed individuals who are simply interested in learning more about health coaching. The course material is the same as that for certification, but testing is different, as responsibility and liability is different for those who are licensed or registered by their state or through National Practice Acts. Society membership is exclusive to those who purchase and study our program. Our personal support is free, and we also have an exclusive email listserv for members for networking and a jobs board that will be coming pretty soon. Our email address and toll-free number are on the last slide that you see there, so please don't hesitate to contact us. We're glad to offer any kind of assistance that you might need. Our NHC's Coach Clinic is a live all-day event that's conducted on site. We spend a lot of hours of practice in motivational interviewing in particular. In closing, I want to mention just a little something about alumni success. Jackie Bryan is really an amazing lady. She's a registered nurse who's been in independent practice now for 10 years in Rye, New Hampshire. After becoming a certified health coach through the society, she's now featured on New England cable news series, in which the news channel is now following Jackie for several weeks in a health coaching series as she coaches one of her clients, Kathy, through weight loss and maintenance. You too can follow this series if you simply go to our website, www.nshcoa.com. That's given there, the domain name on the slide, and just scroll down the page. You'll see a red icon of a movie director's action sign, and you can click on that and watch Jackie as she moves through helping her client, Kathy. There's several others who have testimonials that you can also see on the site by clicking About Us. And I look forward to answering any questions that you may have at the end. Thank you so much.
Great. Thank you so much, Melinda. We really appreciate it. And thank you to everyone who's already submitting questions for us for the end. So I would now like to introduce our next presenter. Her name is Joanne Peterloo. Joanne has over 20 years of combined experience in recruiting, marketing, admissions, coaching, and consulting. She has international business experience in the educational industry, and her passion is in organizational leadership. Her main responsibilities include the recruitment and admissions of MBA students for the Executive MBA and the Healthcare Executive MBA programs at the University of California, Irvine, the Paul Merage School of Business. Previously, she ran her own executive business coaching practice and also worked as the Director of MBA Admissions and Financial Aid at the International Institute for Management Development in Lausanne, Switzerland. Joanne's academic background includes a BA in Business Communications from Michigan State University and an MA in Organizational Leadership from Biola University and a professional business coaching certification. I would now like to turn it over to Joanne. Hello, Joanne. If you want to just unmute yourself.
Hi.
Perfect.
Yeah, can you hear me?
Perfect. Yeah.
Great. Okay, thank you. Very, very pleased and honored to be here this morning. So again, Dominica, you are controlling the slides, right?
Nope, you have the control right now, so feel free to move the slides.
Okay.
Just click on this slide itself.
Okay.
Perfect.
Perfect. Great. Thank you. Great. So just to get started, I want to make a mention of the fact that in the healthcare industry, as we all know, there are still many challenges and changes. There is still a lot of confusion regarding healthcare reform, how it may impact us individually in our organizations, in our current roles, in our functions, as well as our careers, and on a more personal level in our own healthcare and our own healthcare management. Now, with that in mind, I want to make mention of the fact that traditionally in the past, healthcare professionals have not specifically sought out business degrees, and the reality is that more and more of them not only identify and relate to the relevance of it, more and more of them are looking for certification for business courses and MBA type degree programs because they want to be part of the solution in healthcare. And we hear that time and time and time again with applicants, prospective students, as well as our current students and alums who have and are making career transitions. So our brief agenda today is to go through some points that we believe will help educate and inform you so that you can consider the possibilities of taking another step that will give you some business skills and expertise, so that can hopefully also propel you to be ready for these challenges and changes and also augment your own careers. So the top reasons for prospective MBAs, this is information that came from what we call a GMAC. It's a Graduate Management Admissions Council. They do surveys every year and very clearly identify across all MBA programs, including healthcare specifically, that they want an increase in job opportunities. They're looking for salary increases, developing their business knowledge, skills, and abilities, to be recognized in their careers, to accelerate their career paths, of course, and to develop their leadership skills. All of that actually gets rounded out into a main point, which is a very personal thing, and that's for satisfaction. We find that especially in the advanced MBA programs such as ours, which is on an executive level, most of these individuals have been working for a number of years, and so they're wanting to actually come back and put the theory behind the practice that they've had for so long. So we do lead the change in healthcare. Now is a perfect opportunity and time to focus on the skills that you want to develop. And some of the things that we look at within our program is the economics of healthcare, policy, looking at the consumer behavior side, insurance market types and related types of questions. We have a center of excellence here within our school, and we have a healthcare focus every year. It's a forecast conference, actually. And this mirrors also a residential experience that our students have as part of their healthcare business program. And these are some of the topics that they go into more depth in. And again, they really want to focus on the things that are making a difference in the healthcare industry and how business professionals can prepare themselves for those changes. MBA programs and our healthcare program is designed specifically to give you new perspectives. It's designed to develop the skills and the abilities that you need to drive results within your organizations and to understand what those results are. A lot of times in the healthcare industry specifically, you've got these amazing healthcare professionals who are highly skilled, yet at the end of the line, they don't necessarily understand or know what the costs are to run an operating room or what the costs are to buy that new piece of equipment, and how at the end of the day the expense is going to come back to the insurer or to the patient. So these are the types of things that you will learn underneath the skill set. So we teach our students very analytical decision-making and qualitative and quantitative skills. We have actually 12 core courses in our program. Those are required courses, and then we also have organizational behavior, organizational leadership, a lot of other classes and conversation around cases that focus specifically on leadership and communication and presentation skills. And the idea of being a very team-based learning experience is really a very, very important component of every MBA program. Characteristics of our healthcare students, they're all very highly motivated career professionals who have at least a minimum of 5 years of healthcare experience on one level or another. They all have shown accomplishments in their own careers and commitments to the healthcare industry. They've shown demonstrated leadership and really the desire to work collaboratively as professionals. In terms of the profile of our MBA class, this is an example of our 2013 and 2014 current class. It just gives you a brief idea of all of the components. So it's very similar to what you would find in a traditional MBA program, where we're covering all the functional aspects. So you've got individuals in marketing and in sales and in research and development, in operations and logistics and general management. There are solo practitioners. There are MDs and non-practicing MDs. There are consultants, et cetera, et cetera. So we really have a very wide and diverse array of individuals in each of our classes. Here's an example of some of the representative employers. Again, this does show an example of students from both our 2013 and 2014 class. So we do run 2 classes consecutively. And this is absolutely not a limited list at all. And I think the most important thing to note is that there are more and more individuals who are seeking their MBAs and bringing relevance to their organizations, whether they're in the healthcare space specifically, in hospitals or clinics, or again, through specialized organizations. So I want to touch a little bit on our student profiles. So just to give you an example of some of the students that apply in our programs. So Sunny, who is currently an RN, she started working as an educational coordinator. She actually comes from Korea, and she's already moved into a manager position and will be completing her MBA next year and is already being targeted for a leadership role, even a larger leadership role within her company. Alfred, who is a fellow with one of the UC schools here, has just recently accepted a position at a Tri-City hospital in our area down in San Diego. And he, too, is someone who is very innovative, is bringing a lot of great ideas, and decided that he doesn't want to leave his clinical practice, but he wants to augment that and actually be more involved on the administrative side of hospitals. Ernest, who actually started in a family-based business, he is currently the VP of marketing, and someone who's decided to get his MBA degree as a means to broaden out his understanding and approach to the healthcare industry so that he can expand their business and open up additional clinics and branches. Angela is an example. She actually studied psychology and sociology as an undergrad, and she's already moved into higher echelons of admitting supervisory work within Hoag Hospital, and she's in her first year with us right now. So here's a couple examples of our alumni profiles, and again, I just want to show you an array, a little bit of where these individuals are coming from and what they're doing. So Wendy is bilingual, Hispanic, and she's a fluent English, of course, and Spanish speaker. She's been working within the Children's Hospital for many years and actually has a master's in public health. And she decided to come back and get her MBA because she understood that there's more that she can actually contribute to the organization with better business skills. And she's actually thriving in her work now and has moved from a manager to a program director during the time that she was in her studies. Lara, who is actually an executive and ambassador to Abbott Laboratories, her background is in biology. She has never been a practicing healthcare professional per se, and has made some really amazing accomplishments within her organization and continues to be at the forefront, very much at the cutting edge of her organization. And she's also served, she's one of the past presidents of the Healthcare Business Women's Association within Orange County. Umang, who is more on the technical and analytical side, has moved from the research side of hospital to now working for Oracle and is doing business development and is further advancing himself also in larger arenas outside of his technical field from IT. Michael, who is an example of one of our practicing MDs, he's a cardiologist and a co-founder and chief medical officer of a company called Uncle Care. And Michael has won several awards and has been well recognized also within the device space by actually innovating something and now taking it to market that will actually help patients and medical professionals within the field of his expertise. So these are just some examples of our alumni profiles, and again, as we move along through our discussion, if there's other questions that you have, or in time if you want to take contact with me and learn more about individuals that might have something in common with you specifically, I would be very glad to put you in contact with them. Just as a closing point, I want to just mention some of the things that our alumni and students say. The relevance of the program is really that every weekend that our students are in class, they get very important, significant golden nuggets that they bring right back to their workplace on Monday morning. So what they're learning in the classrooms are very significant, and they are making the changes in the moment in their businesses, and that is actually being on the cutting edge of their businesses. I just want to transition quickly into a few things about our program. We are a very highly ranked MBA program, 25th nationally within the United States, and we are the top 10 in the U.S. And 44th in the world for executive MBA programs. We have a specific healthcare executive MBA program, and we've been very, very proud to be ranked in the top 30 consecutively within the last 3 years. We do have a 21-month program, and it is a 7-quarter program. We have something called residentials, and those residential experiences are off campus. And one specific residential is focused on healthcare policy, and our students go to Washington, D.C. for a week every year in December, and they actually sit in Congress, they meet with lobbyists, and they learn a lot more about healthcare reform. All of our students say that that is absolutely a capstone course for them as well. So we are a weekend program. It's an intensive, extended, long weekend, and our classes start in September. If you want some additional information or would like to have a private conversation with me or my colleague, Connie Zigarelli, our Director of Admissions, please know that we welcome you to contact us. Thank you very much.
Wonderful. Thank you so much, Joanne. We really appreciate it. So our last presenter, but certainly not least, is Sydney Slover. Sydney is the president and co-founder of LearnItLive, an interactive social learning network. LearnItLive provides a technology platform and network of experts for corporations, healthcare organizations, and governments to train and educate their population in real-time online classes. I would like to turn it over to Sid.
Thank you very much, Dominica, and thank you everyone for attending today's session. Welcome. So we're going to go over, certainly, of course, I'm going to talk a little bit about LearnItLive and talk a little bit about e-learning, interactive online health education in general. And, you know, it was great to hear some of the other speakers and kind of commenting on the progression of the industry and the different, I guess, regulatory issues that have come up from the Affordable Care Act and other things that are really pushing the whole industry in this direction, which is going to be, you know, online health and wellness, online care, online education, and, you know, it's kind of exists and lives in this broader space. So I put a quote up here on the this main slide, and it really, you know, really holds true, and I think everyone has seen it manifest in our current lives. 5 years ago, an amazing teacher, professor, with the ability to truly catalyze the lives of his or her students could realistically hope to impact maybe 100 people each year. Today, that same teacher can have their words spread on live video to millions of eager students. And so that is our mission and what we are working on, which is to bring together a network of experts to reach the masses, to reach millions, essentially. So let me see. Do I have screen control here, Dominica?
Yes, you do. You should. See if you can move your mouse. I can also move it for you.
Okay, I don't think I do. I'll tell you to change slides. Okay, so I think everyone probably knows this intuitively. Classroom-based education is expensive and inconvenient. You know, often it is the only solution if you're looking at some certain subjects, but you know, sometimes it's not even the best form of education for the particular case. And I just put a couple of quotes here about you know, people who have done studies and about the effectiveness of online education. The government have done studies that show that online education and online interaction can even be more effective than the in-person experience. And looking at the e-learning growth rate, it's really certainly picking up in terms of how people are getting their CMEs. You've got virtual counseling. I mean, we're all right now, this is a form of e-learning, and it's becoming more and more commonplace in our life. So talking about how you make it effective, and if you would go to the next slide for me. Great. So really making the interaction and making these classes the most impactful, it's about interacting, just like in the real world. If you have a teacher, if you have a professor that's going to stand in the front of the classroom and just talk to people, maybe a little bit like what I'm doing right now, but you know, not really get people involved or inspire them or listen to what they're thinking about, then you're not going to get as good of a result as if you have that truly personal and interactive experience with the teacher. Whereas regardless of whether they are in China or in France or, you know, down the street, you are getting to know them and getting a personal interaction. And so that is what we focus on at LearnItLive, is creating this fully immersive online interactive network to make it so that the classes are engaging. If you go to the next one for me. Thank you. So looking at the market size and the growth, you know, and why you all should get involved or certainly start thinking about it is, you know, last year the e-learning market size was 90 billion, right? 2015 it's expected to pretty much double, and by 2017, it's going to triple. So that's going to be within 5 years, you're going to see 3 times growth to be a $250 billion industry. And if you've been paying attention to the news or seen anything about it, you can already see this manifesting in our day-to-day lives. Coursera is out there, then that's going to be college courses. You have other players that are going to be in the more business or entrepreneurial space. But you're going to really start to see it manifest in the healthcare industry as a lot of these things from the Affordable Care Act come online. You've got more certification and safety requirements. So the HCAHPS is an example. You know, other sort of things that hospitals are going to have to do, that professionals are going to have to do to keep up. Then you have incentives. Disincentives for patient readmission can be another example. This is going to be on the wellness side. So for example, if a patient leaves after a heart surgery and they have to be readmitted within 30 days, they're going to, within the Affordable Care Act, it's actually a negative revenue figure for the hospital. The hospital has to pay for it. Well, how are the hospitals then going to do what's called hovering? Or how are these organizations going to hover over the patients when they're in their homes in a cost-effective manner? You know, providing them continuous care and continuous education that's going to be more in an engaging style. Well, e-learning and what we're doing at LearnItLive can fill that need. And then, of course, you have incentives for corporate health education. And one of the presenter mentioned this in the previous talk, which is that there is way more of a move towards this wellness education, and in the Affordable Care Act, there's $200 million a year that's going to corporations to encourage wellness care. So now I will address specifically, and I will expedite a little bit, you know, what is LearnItLive? We are a social learning network that connects people to health and wellness experts in interactive online classes. It's a little bit about our background. We were established in 2009. The sessions, the core of them are live, they're interactive, and proven effective. We've got 1,500 experts that lead all kinds of topics on different health-related fields. So that's going to be a little bit more of a healthcare-related, so clinical, and then you've got nutrition, a lot of nutritionists, diet programs, fitness, yoga, cooking, diabetes, all different types of classes. And then members and employees, the students, will attend the online classes via LearnItLive, where you can see a marketplace, or via a private white-labeled learning center where we customize content and provide these classes out to people. So a few of the organizations we work with below. If you can go to the next slide for me, Dominica. Here's a screenshot of the sessions, just an example of the interface. It's not all that different from the interface that we're in now. You've got the slides, of course, but really you've got live video, and if you recognize that the presenter, he's actually a chef that was on Top Chef, Fabio, the fan favorite on the show Top Chef for all of you Top Chef viewers. You've got your you can see your participants, you've got different breakout rooms, you've of course chat that's scrolling, different emoticons to show emotion, everything that's going to be able to really allow the instructor to make the sessions engaging and interactive. And we provide the tools and the information to allow anyone, regardless of whether they're an introvert, an extrovert, a good teacher in person or not a good teacher in person, utilizing the tools that are within that and utilizing a process that we walk everyone, all of the experts in our system through in a very short period of time, an hour to 2 hour long session, you're able to be really engaged in doing it. So I'm going to walk through just a few of examples quickly of different case studies. If you can jump back one, thank you. So this is, we work with all different types of experts, but here are a few of the featured ones. So here is a wound care nursing session that Dorothy Doty led to a group of students all around the country. It was $100 per student, $100 to attend this class. I believe it was a 6 hour long course, day-long course. And they generated over $10,000 for their organization and for the expert doing this. Next slide. So here's another case study of Dr. Esselstyn, who is a doctor at the Cleveland Clinic. He is the star of Forks Over Knives, if you've seen that documentary, a best-selling author. And so he ran basically heart health classes that are more for public education and wellness, tied into promoting his message. I mean, he's all about changing the world and how the world understands plant-based diets and health, basically. So next slide. And here is this is another group. This is Society of Clinical Nurse Specialists. They do different nursing classes and different things revolving around HIV, more technical things. And this is actually a group of healthcare professionals that are putting on these sessions. So in addition to these, you just go to LearnItLive.com and you'll see a breadth of health, wellness, and other classes. And so really, working with some of the groups that we work with, we need a broad range. We're looking for a broad range of health professionals, not just, let's say, the keynote speakers or, best-selling authors. It can, really, there's an opportunity to get involved on a variety of levels, and I'll provide more information in just a couple of minutes. So next slide. So here's just an example of a white-labeled learning center. We work with different companies and provide them specific content and specific experts. So let's say Coca-Cola is looking for diabetes education just for, for their employees. Well, we would provide a center of, just diabetes experts and diabetes classes. So that's an example of how this is utilized and how we work with companies and organizations. Next slide. So we do, as I mentioned, provide training for all of our instructors and experts. I've set up a couple that are going to be for participants of this class, of this webinar. It's going to be free. Set it up free for these members. It's on 5/16, so that's going to be in a couple of days. And then next week, if you go to LearnItLive.com/LIL, you'll see the listing of these classes, and I highly encourage you to go and, if you're even thinking about it, go and attend a live session, so you can kind of see how the environment is. So go to the next slide, last slide. So, want to come and instruct the world, you want to see about getting involved, it is you're not committing to anything, we'll provide you with more information. If it perks your interest and is intriguing, go to LearnItLive.com and sign up. add Surround Health to your application so that we understand that you're coming from Surround Health. Let your friends and colleagues know other people that you think would be good at this environment and that you think needs to be reaching the world. And then there's my personal contact information. And send me an email. I'm available to speak with you. So thanks very much.
Great, thank you very much, Sid. So I do apologize. It is 2 o'clock, so I know we are out of time. But we did get a ton of really, really good questions, so I do want to make sure that we get to them. So if you do need to jump off, please feel free to do so. We will continue recording this session, so you can always watch the Q&A at a later date, if that's okay with all the panelists, of course. So the first question that we have is for Tricia. So Tricia, if you could just unmute yourself whenever you have a chance. So can you provide us
I am unmuted.
Excellent. Can you please provide us an example of a procedure that you have found for a patient or client that has been deemed unnecessary? Are there any red flags to look for specifically?
Oh my gosh, what that is an advocacy question. So you're asking me to position myself as a patient advocate, which I can't and won't do because that's not my expertise in this case. I can give you general information from a patient empowerment point of view. I would never tell you that something was over-treatment or unnecessary. What I would say instead is that I can teach someone to ask the right questions to determine for themselves whether something is needed or whether it's unnecessary. So as an advocate, that's the kind of work you would do. So just to be clear on what the difference is, the work I do is actually helping advocates build businesses. So I help them with the legal aspects, you know, forms and contracts, the insurance aspects, the marketing aspects, and those kinds of things. But the actual determining what's right and what's wrong for an individual patient, that's all individualized.
Great. Thank you, Tricia. The next question is for Melinda. Melinda, what are some of the most common issues for health coaches that you've seen or you've come across?
The most common issues are challenges. I think the most common issues really now are not surrounding the health coach as much as it is health coaching and the requirements for becoming an evidence-based health coach and the differences in evidence-based health coaching and health coaching. The different types of programs that are out there and people trying to choose which one is the right one for me truly is the biggest issue that I see. And the hundreds of calls that we get on a weekly basis deal more with those types of questions.
Great. Thank you, Melinda. The next question is for Joanne. Joanne, what are the top 3 qualities that you think would make for the best candidate for an MBA program who's also a healthcare professional?
The top 3 qualities, definitely someone who is very, very committed to their organization and committed to improving the inner workings, especially from a team-based experience. I would say someone who has a broad mind and perspective, very open-minded to want to learn new things and expand the way they're thinking. And I would say someone who also is really looking to make significant changes in their own lives as a professional, as well as impacting and improving the lives of other people. I would say that those are definitely the qualities that will bring any student in any of our programs to great success.
Great. Thank you so much, Joanne. So the next question is for Sid. Sid, there are a couple questions that we received around LearnItLive and how you make money and the differences between the free classes and the paid classes and how people are able to make money for themselves. If you could just elaborate on that.
Absolutely. So there's 2 core monetization ways of doing that. One, if you are looking to extend the reach of your personal reach and exposure and put on classes through the public marketplace. then generally people will run a free class, a promotional class, and get students into that, and then monetize it in a more advanced program. So that could work in a teaser to a nutrition or a diet class, and then go into a, let's say, $100 or $150 3-week or 4-week program. That's generally how people will do it within that marketplace. And then secondarily, we do work directly with organizations, so companies, health providers, health organizations that are looking for this particular content, and then we will directly license the classes at a specific rate from the expert, that is from the teacher that's providing the class. So that would be whatever, $100 to $500 depending on the specific topic that is that's going on. And then as well, those classes are also sold generally through the marketplace. So there's additional monetization capabilities within that.
Great, thank you, Sid. Another question for Melinda. Melinda, how and when do health coaches market themselves? Melinda, we can't hear you.
I'm sorry. What we have found is that most health coaches will market themselves through an online avenue and getting connected through Twitter, LinkedIn, and so forth. We also have a LinkedIn group called the National Society of Health Coaches that you'll see several hundred people being a part of that will let each other know that they have certain services to offer. And then locally, it all depends on if you want more of a local practice or if you want to do telephonic health coaching, which would be to actually go online. Those are typically done through managed care and insurance companies, although we know that that is going to be continuing to move forward into independent practice type of modality.
Thank you so much, Melinda. The next question we have is for Tricia. Tricia, I'm interested in becoming a health advocate. What do you think the first step is that I should take in wanting to learn more and become a health advocate?
Well, the first step, I think, would be to go to that web address that I provided for you, which is just healthadvocateresources.com. Go there because what you'll find are a bunch of possibilities. So it will help you with everything. For instance, if you think you might need coursework, one of the links that you'll find there is to a website that lists all of the programs that are being taught across the country in health advocacy. There's also a link there to an article that will walk you through so you can determine what kind of education you might need. There's also a link to standards of practice and code of conduct kind of information, so you can see whether those are tenets you ascribe to, whether you'd be interested. There's also the membership in the Alliance. As I said, it's $49 for the year. It gives you access to tons and tons of resources for not only deciding whether this is what you want to do, but also deciding what you would need to do to prepare for it, and it helps you network with everybody else who's doing this kind of work as well. And then one of the books that I wrote is called Start and Grow Your Own Private Advocacy Practice, and that's soup to nuts, step by step. This is where you get started, and it helps you build not just your business plans, but helps you get all those decisions out of the way that you're faced with as a new business owner. So I'd say any of those would be good approaches.
Great, thank you, Tricia. So one more question for you around salaries. What would you say the average salary is for someone who has been a health advocate for less than 5 years?
There is no salary, because salary would indicate that you have an employer. But if what you're looking for is a general income, first of all, to say somebody's been around for 5 years, there hasn't been really, I don't think there have been more than 3 people in the country who have been around for 5 years. So that would only be a guess on my part. And it would depend on whether you were doing the work just on your own, so that you as the advocate would receive all the phone calls and would perform all the work, or whether you might work with independent contractors who could do some of your work, or even if you would just start a corporation. And there are some businesses being started. I hate to tell you too much about them because they're all in their infancy. They're all less than a few months old. So I would hazard a guess to say that if you, at the end of 5 years, were still successful and were growing your business to where you had a couple of people who were working with you, not necessarily as employees, but maybe as independent contractors, I think you could easily, and this is a guess, it's an educated guess, I would say you could make, depending on where you are in the country, anywhere between $75,000 and $100,000 a year. But then if you started to grow it as an actual business where you were hiring employees and so forth, I think you could do a lot better than that.
Great, thank you so much. Melinda, next question is for you. But I think, Tricia, you might want to jump in afterwards because I think there's definitely something there for you. So, are hospitals and clinics starting to open more employment positions to be care coordinators, healthcare advocates, and health coaches? For someone who has an MPH-CHES wanting to find employment in this area, what's the best way to go about doing so?
Yes, absolutely. There are. We see more and more hospitals, and including all other healthcare settings, but even hospitals that are moving into the health coaching arena, simply because the goal to reduce readmissions, because they are so costly, readmissions from, say, the same diagnosis that the patient had 30 days ago. They're not good. Hospitals are not going to be paid for those types of admissions. So the cost issue is really getting where it's bearing down on all kinds of professions and knowledge about what to do in order to reduce readmissions. So they're beginning to look to health coaches in order to follow the patient from discharge to home, even in home health. That's where we're beginning to see health coaching increasing more and more, and that is so that they can coach these patients through transitioning from the hospital to various settings, whether it's home care or going home without home care. Maybe it's just a coach that's going to be helping that individual from the physician's office. So there's all points are open in terms of where a health coaching can reside and to practice.
Okay, great. Tricia, is there anything else you wanted to add to that question?
Well, again, and I'll emphasize this again, there are not employment positions, and there are patient advocates, health advocates working in hospitals, and they're working in a variety of capacities. But I go back to what I mentioned to begin with, is the allegiance factor, and this weighs so prominently in private advocacy, independent advocacy, and that is that the minute you have somebody else paying you, whether it's an insurance reimbursement, whether it's a hospital paycheck, whether it's an insurance company that has hired you as an advocate, you are no longer 100% beholden to your patient, and that gets in your way. And so the whole reason somebody has hired you to begin with, which would be to help that patient get through something in the system that isn't working, if you're being reimbursed by insurance, for instance, well, you know, now the insurance company can tell you yes or no, you can do something. Going back to the patient advocates who are working in hospitals, I think a lot of them are doing a wonderful job. I can't tell you for sure what the parameters are for hiring them because that's not my area of expertise, but I can tell you that a lot of the people who come to us to become independent advocates have worked as a private or as a patient advocate in a hospital in a prior life, and the whole reason they're making that shift is because of their frustration that they can't do for patients in the hospital what they can do independently.
Great, thank you. Joanne, the next question is for you. What do you see as the biggest area of opportunity for those who are interested in getting an MBA and who do get their MBA?
In terms of career perspective?
Yes, I believe that is what they're asking. If you could just speak up.
Yeah, absolutely. Can you hear me okay?
Yes.
Okay. I had a really interesting conversation with our executive coach from our MBA Career Center about this actually the other day. And he illustrated for me all of the amazing positions that are being created because of the changes in healthcare. And I'll just give you a couple. So for an example, there are so many things that are going, if you will, into cloud computing arenas. There are so many things that are absolutely being built out from the IT or the technical perspective. There are so many things, as you've heard on this call, that are created from needs. So many students as well as advocates out there are creating niche markets for themselves because needs are not being addressed within these various industries and sectors. So to tell you, is there a specific thing? No, there's not. There's really an important, I would say, element is to be open, to understand, and look for opportunities. Keep yourself in conversations with individuals who are telling you things and hearing things from you that will propel you to take a risk and potentially do something new or different, or transition yourself into another level within your organization. So it can be anything, you know, on the marketing side. Social media marketing is an absolute must. Anything just in communicating out messages. Healthcare industries are not traditionally good communicators to the general public about their products and services, so that's a huge need. And I would say really bridging the gap between business and healthcare, anything that will help make that happen in a smoother and more effective and efficient way. Cost reduction is a huge area, especially on the consulting side and within healthcare businesses themselves. A lot of medical professionals are moving from group practices and individual practices to more group practices. Many healthcare professionals that might have been in the clinical space or practicing are deciding to actually become consultants of larger types of groups. So they're really limited. They're limitless.
Great. Thank you so much, Joanne. Sid, the next question is for you. Is there a conflict of interest in ensuring that students who attend online classes expecting expert level types of information versus the expert instructors who are making money off of the sessions?
Okay, wait, let me see if I get that correctly. So if the students, wait, there's a conflict of interest that they're, hold on, let me look.
So let me repeat it again. I think the question is there a conflict of interest for professors or experts on your site who are charging for their material if they work for any type of healthcare institution? Hello, Sid, are you there?
I am. I'm just trying to make sure that I answer this correctly. You know, I don't see that that has not arisen. I do not see that there is a conflict of interest there. Expecting expert level information versus the expert instructors who are making money off of the sessions. You know, they are getting, as far as getting expert level instruction, is we are placing for a lot of these programs, we're placing, you know, certified top expert, you know, teachers and qualified instructors in these classes, and people that know how to give you know, the sessions correctly. So, you know, in terms of, I guess the answer is, to my understanding of the question, is no.
Great. I believe that is what they were asking. Thank you very much, Sid.
Okay, great.
So the next question is for both Tricia and Melinda. In terms of health coaches and health advocates, does a community health worker encompass both? And how about those who are certified health education specialists? Would you say there are any specific differences between those?
I'll try to answer that first. This is Tricia. I would say that anyone who has any sort of health background where they have worked with the general public, less about clinical type things, diagnosing and treating and so forth, and more about system type challenges, which is what I think both those careers you mentioned address. I think that that's a great, that private advocacy is a great place, or even health coaching. I don't want to speak I don't want to speak for Melinda, but I do want to say that anything where people have had to navigate the system and then want to advise others on how to navigate the system is a perfect way to open that kind of a career.
Specifically on the health education specialist and the master's specialist do qualify to receive health coach certification from the society as long as they have a year's experience in a healthcare setting guiding patients or clients.
Okay, wonderful. Thank you. Sid, there was a question for you around multilingual instructors. Do you have multilingual instructors on your site currently? Are you accepting them? If you could talk about a little bit more about that.
Sure, yes, we do. I mean, we actually do a decent amount of work specifically in the Middle East, but we have instructors that do classes in Spanish and in some Mandarin. There have been some classes. So definitely, if you're thinking about if you teach classes in other languages, you provide the information in other language, definitely I recommend signing up.
Okay, great. And we will just take one last question. This question is for Tricia. Tricia, with self-pay being sort of the reimbursement structure, are those who are lower income at a disadvantage in your opinion?
They can be. Now, I say that with, I hesitate because that goes back to that question that I had earlier that I addressed about some of the objections that people come up with, and they say only rich people can afford them. And it's true. Since they're self-pay, it's got to be somebody who's at least got enough money in the bank to cover that cost. But I will also say in the bigger picture, the fact that people are hiring individuals to help them out means that there is less of a drain on the system that they are trying to navigate. And the example I give, the metaphor I give, is public schools. And so in the United States of America, we promise every child a public school education through grade 12. Now, that doesn't mean that the schools are providing piano lessons or weekend soccer or some of those other nice things that parents pay for their children. And it doesn't mean that the public schools are subsidizing private education for some children whose parents choose to send them to private schools. And there are scholarships available, and there are alternative ways of paying for all of those kinds of things. But the other thing is, when a parent pays for a private school, that doesn't mean that the parent isn't paying taxes. And again, if a patient pays for a private advocate, it doesn't mean that they're not paying into the insurance pool. But when that child goes to a private school, then that child is not using the resources in the public schools. And when that patient is using a private advocate, that means they're using less of the resources in the healthcare system. So I hope that kind of explains it. I think it's kind of like the same question that we were asking in the late 90s about whether or not anybody should have access to the internet, because poor people didn't have access to the internet. And what we have found over time is a way of making it far more equal and making the internet available to people who didn't have the means to pay for whatever the monthly bill was going to be for internet access. And we will find that too. It's just that we're so young. I mean, literally, we're talking about a career that in large groups has only been around for a few years.
Wonderful. Thank you so much, Tricia, and thank you very much to all of our panelists. I know that we weren't able to get to all of the questions, but I do want to encourage all of you to, whose questions we didn't answer, to go on Surround Health and ask the questions. I will gladly connect you with each of the 4 panelists to make sure that we do get all of your questions answered. But we are out of time. So as we get ready to close up, just a couple reminders. Your webinar completion certificate will be available in your Surround Health profile starting tomorrow. The webinar has been recorded and archived, so if you missed any portion, please feel free just to go on Surround Health, and please complete our feedback survey if you'd like to receive CHES or RD credits. And even if you're not getting credits, we absolutely want to hear your feedback about today's session. Thank you very much again, and have a wonderful day.